Hey everybody, Dr. Vince Gutierrez here, physical therapist from Joliet. Today I want to bring up an interesting topic. I've had this experience now with multiple patients over the previous week. They come in, we always ask, well, your therapist should always ask you, have you had therapy in the past? Just with some of the conversations that I've had this week, I realize not all therapists are asking that. So again, your therapist should always ask you, what type of therapy have you had in the past? Because it gives them an idea as to what they should not be doing that didn't work in the past, so they don't waste your time. And it lets them know whether the therapy you've had in the past has any system to it, or was it just, shotgun, let's throw everything at you and hope something sticks. I mean, maybe shotgun's a bad approach, but whatever. So what I want to talk about today is I've had a couple patients come in this week and they've said, my therapist previously told me all the things that I couldn't do, but they never told me the things that I can do. And let's face it, you're going to therapy so you can get your life back. My job is not to take from you, my job is to give to you. And my job is to empower you to go back to doing the things that you want to do, the things that make you happy in life. I mean, that's the reason you're going to therapy, right? People don't come to therapy just because they have pain. People come to therapy because they have pain that's keeping them from doing what they want to do in life. So I'll be honest with you, I had a couple patients just this week where they couldn't bend over to pick up their kid without back pain. They're not here because of back pain, they're here because they can't pick up their child. And my job is not to say you should never pick up your child again, because that's absurd. Who does that, right? Apparently some therapists do that, but that's neither here nor there. My job is not to tell you what you can't do. My job is to figure out, is a way for me to get you to pick up your child while helping you get your back better so you can pick up your child the way you want to pick up your child. And this is where we have to modify movements, but we should never be taking movements away from you, right? I have plenty of patients that they say, when I bend like this, it hurts. Well, don't bend like that. It's usually that's the advice my dad would give, right? But if your therapist can only give you the advice that you can get from my dad, you should be paying my dad money, and your therapist shouldn't be charging as much. What the therapist should be saying, well, if you can't bend like this, can you bend like this? If you can't bend like that, can you bend like this? If you can't bend like that, can you bend like this? Right? There's a bunch of different options for you to do what you want to do, to live the life you want to live, without us just taking from you, right? And it's a pet peeve of mine to have therapists essentially tell you that you're broken, and you shouldn't be doing that to begin with, because there's very few options, there's very few things in life where you shouldn't be doing some things because you run a great risk of hurting something else. And there are a couple things, but I probably won't say them now, because if I tell that to the large crowd, then a lot of people will be afraid of doing those things, and I don't want to do that to you. That's not fair. But just know, your therapist should be empowering you, not taking from you. You guys have a good day. Have a good Labor Day. Thanks for watching.